You may not know this, but we are fast approaching a rather startling anniversary. It's almost a year to the day since our borders closed on the 20th of March 2020. I'm sure that will give all of us some cause for pause and reflection. And it's a prompt for me personally to say thank you once again. The business community's response to the challenge of COVID-19 and all its unprecedented impacts has been critical. You have played such an important role as we have navigated uncharted territory. I recall thinking at the time of the border closure that it was probably the most significant decision that we as a cabinet would ever take. My chief of staff felt the enormity of it too. He still has the front page of the paper from that day. But in many ways, that was just the beginning. I know that the last year has been hard, extremely hard. Some businesses have not survived. Others will never be the same. So while this evening I may speak to some of the relative success we have had as a nation, I don't for a moment want to diminish the toll that it has taken. There is no costless response to COVID-19, and while the price we paid may have been lower than many others, it has still come at a price nonetheless. But the strategy that we followed, and the one that I indeed still stand by, was that the strongest possible health response was also the best response for the economy. And that, I think, has proven to be true. We've been judged by Bloomberg, the Lowry Institute and others to have had amongst the best pandemic responses in the world. And as a result of that response, our economic recovery has been amongst the strongest. Our unemployment rate of 4.9% has defied earlier predictions that it could be triple pre-COVID levels. The average jobless rate across the OECD is in fact 6.9%. Last month, we received a credit rating upgrade from Standard & Poor's, their first anywhere in the world since the pandemic began, and New Zealand's first upgrade since 2012. And in terms of daily life for most New Zealanders, we have been largely, for the most part, free to socialise, to attend gatherings, to travel widely around the country and to visit vulnerable or sick family and friends. An Oxford University study placed New Zealand lowest in the OECD for COVID-related restrictions, such as workplace closures, and New Zealanders have been required or recommended to stay home a total of 82 days, compared with 271 in Australia and 332 in the United Kingdom. I think the point when some of those numbers really hit home for me was when I was recently reading the latest out of the UK. They went into their third extended period of lockdown restrictions on the 4th of January, 2.5 months ago. The recently released plan to lift those restrictions included the prospect that 2 households in England will soon be permitted to meet again in a private garden at the end of March. It has been incredibly tough out there. One thing that strikes me every time I have a discussion with another world leader is just the degree to which we have all had to operate in an environment with so much uncertainty. And we continue to do so. In New Zealand, we have talked openly about that. Where we didn't know enough yet about COVID to make definitive plans, we have been open about that fact. And when we did, we shared it. And that is what we will keep doing. And so this evening, I wanted to set out as clearly as I can some of those key decisions that we need to make in 2021 to continue to keep our people safe from COVID, while, though, reopening New Zealand up to the world as safely as possible. But where there is uncertainty, we'll also clearly flag that. I also want to talk about seizing the advantages provided by our successful COVID response. The first and most important point is that throughout the year ahead, our COVID strategy remains to keep people safe from the disease. And the key reason we adopted elimination strategy was because of the safety and protection it offered our citizens. While COVID does not have a fatal impact on everyone, we knew that it would for many. And so long as the disease was able to jump successfully from person to person, then it had the ability to reach our most vulnerable. Keeping people safe and well continues to therefore be our focus, but what does that mean with a vaccine in the mix? It means changing the method we use to block COVID and stop its transmission. Now currently, because we have no personal protective layers against COVID, we'd have to use our environment to protect us. That has essentially meant building a wall in the form of border controls, in the form of managed quarantine facilities, and in the form of isolation where we're worried someone may have come in contact with a case. We have essentially built a barricade. But as we all know, a barricade is not without risk. This has always been a very tricky virus. And if there were ways to get through our barricades, it has certainly tried to find them. And that is where the vaccine comes in. It offers us the chance to move away from a barricade to instead individual armour that we each carry with us. And if enough of us wear that armour, we can act as the first line of defence, stopping the chain of transmission for those who, for whatever reason, can't. That's why our aim is to vaccinate everyone who can be vaccinated before the end of this year, because it offers the safety that an elimination strategy has brought, but with greater freedoms and less risk. With this transition in our COVID management approach, though, comes some really key questions. The first is how many of us need to wear the vaccine armour in order for us to reopen our borders or to change the way we have been having to live. Officials are working with experts on modelling this very question as we speak. But just to give you an insight, we'll need to take into account efficacy of vaccine and, for instance, the number of people who cannot currently be vaccinated. For example, our currently MedSafe approved Pfizer vaccine is not currently available to under 16s. But regardless of the specific number, our overall objective is to move our defences from our border to our people as soon as possible and in such a way that our armour is also well spread. Otherwise, we run the risk of outbreaks again. Even if we have 70% of our population, for instance, vaccinated, if we have a large proportion who are not in, say, South Auckland, we run the risk of outbreaks still. So we need to be mindful of that distribution. So that means the biggest challenge for us all this year, and I do mean all of us, I'm socialising this problem, is to get New Zealanders vaccinated everywhere. Now, our research shows that about 70% of New Zealanders are happy and ready to get vaccinated, which is great. Of the remaining 30%, 25 or so aren't against the vaccine, they just have some hesitation or concern, or they feel they don't know enough about it yet. It's our job to address that hesitation and those concerns and give all the information that people need. Our vaccination roadmap has already been set out, and many of you will be familiar with it, but 50,000 border and MIQ workers and their household contacts are already underway as part of our program. Also underway are our frontline healthcare workers. Next will be people living in high-risk settings like aged care homes. From May, we'll start with priority populations, approximately 1.7 million people aged 65 plus and those with underlying medical conditions who are at higher risk. And from roughly July, I say roughly because delivery schedules are not always certain, but from roughly July, as vaccines continue to arrive on shore, we expect the remainder of the population aged 16 and over will be able to come forward and be vaccinated. And our plan is to complete, therefore, that rollout by the end of the year. Now, speed will be important to our plan, but as I've said, we also have to bring people with us. If we roll out the program without addressing people's questions, it may mean that we don't reach the numbers we need to protect the community. And that's why we've been focused on a strong research-based campaign. In fact, that research and evidence has told us that a strong influence over people's decision to get a vaccine is not about themselves. They're most convinced by the knowledge that it will keep other people safe. Being vaccinated will ultimately, therefore, become a selfless act, and it will be up to all of us to keep reminding one another of why that is so important. But everyone in this room has a part to play as well. We've been working closely alongside the private sector as we develop our vaccine rollout plan, from freight, logistics companies to HR professionals to IT experts. If any of you in the room have been involved in that, I say thank you. We want to keep up that collaboration as well. Rob Fife, who many of you will know, has been working closely with me and the government in our connection with the private sector in response to COVID-19, has been working on a model to help support ongoing business engagement. And we'll be reaching out to people shortly to confirm a proposal to ensure really strong lines of communication as we move into a really intense period of work on the rollout. It really will be all hands to the pump. So, in the meantime, if you have a work site, please offer to be a vaccination venue. We'll make sure that we provide details of the requirements for that. Please promote positive vaccination messages and create a workplace vaccination plan to make it as easy as possible for your workforce. In the same way business support for COVID measures last year drove our success, in 2021 we need that same level of support to make the vaccine rollout work. It will be our quickest path to normality. So the vaccine is at the core of our COVID strategy in 2021. It is what I consider really our baseline activity. And it's really the program that we have at the moment the most certainty around. But there are other pieces of work that could also change up the way that we do things and the way that we live. First, we're engaged in work being done internationally on what is being loosely called vaccine passports. We've also been monitoring the research around the impact of a vaccine on COVID transmission. We know that, for instance, some of the vaccines in the market are as high as 95% effective in stopping someone who's been vaccinated becoming symptomatic from the virus. That doesn't mean you can't or won't pass it on to someone else. As people are vaccinated, of course, the research here will grow, and we'll keep an open mind till then over whether vaccinated people could safely enter New Zealand without quarantine, even if we haven't finished our vaccine rollout. But as I say, this will take time and it will take additional research and data. Having said that, we see a trans-Tasman bubble very differently. Opening up quarantine-free travel with Australia remains a priority for us, not only for tourism and business, but also in terms of reuniting friends and families. As such, Cabinet has issued new instructions to officials to create options for managing trans-Tasman travel that aren't based on a formal agreement with the Australian federal government. This means that when New Zealand opens up quarantine-free travel with Australia, we will manage the travel on a state-by-state basis in accordance with public health conditions in each state and in New Zealand. Now, a whole-of-country formal agreement had been what we were working to, and on both sides of the Tasman. And even after some states opened up quarantine-free travel, that work had continued. And there was good reason for that. A reciprocal two-way arrangement meant working together if there was a need to close both countries' borders to each other. It meant joint arrangements on who was and wasn't eligible to travel. It meant formulating rules on how to treat transit passengers, for instance, and how to manage third country approaches to enter the bubble. Essentially, it would have allowed us to work with Australia as one entity with one set of rules, which was appealing. Capacity constraints in the Australian managed isolation system, though, that really changed up those arrangements. And 3 states have since opened up to New Zealand. That is totally understandable. On the Australian side, they're dealing with one country and one set of rules. For us, there are complications dealing with different states. For example, since quarantine-free travel started with Australia, it has been stopped twice at a federal level, and the majority of states, it is still the majority of states, including Queensland, remain closed to quarantine flights from New Zealand. Now, that does give a sense of the complexities that we will need to manage in a trans-Tasman arrangement. And there is every chance that once we open, people will be stranded on either side of the Tasman. But While this has made things more difficult, the challenges are not insurmountable. We will get there, and I'm very confident it will be soon. Opening the Trans-Tasman bubble will have a further knock-on effect in terms of other decisions for the government, especially the management of managed isolation. At this stage, it's too soon to say what it will mean for capacity, but I do think Michael Baker made an important point when he reminded us all this week that freeing up, say, 40% of space in managed isolation by removing New Zealanders coming home from Australia and then filling them with people from COVID hotspots does increase the risk of COVID cases in our community, and that is a reality we're aware of. We will look, though, to outline our plans around MIQ capacity at the time that we make announcements on the Trans-Tasman arrangements, just so everyone is clear on how that will be utilised. In the meantime, as I said at the beginning, while we're without our armour, our goal is to keep COVID out. So while we're ramping up our vaccination campaign, and when we resume travel to Australia, it may still well be that we maintain strict restrictions on returnees from the rest of the world for the short and medium term. The second and third significant opportunity I see presenting itself in 2021 is the chance to build talent and innovate within our own business community in New Zealand, whilst also attracting skills and investment into the economy. There is a significant opportunity to leverage our global brand as not only clean and green, but safe. That is an enticing proposition to business and investors who are being so badly affected by COVID overseas. Microsoft's decision to establish a data centre region for cloud services in New Zealand in May last year was an early indication of the kind of opportunities that exist for New Zealand. We need to actively seize these new opportunities and signal to the world that New Zealand is open for business and quality investment. Cabinet has asked Stuart Nash, tasked him with developing opportunities for how we can make the most of our position to attract talent to New Zealand to help us further our recovery. We've also asked the Minister of Immigration, Minister Chris Farfoy, who is here, to think more broadly about skills and training in New Zealand and the overall job market in a post-COVID world. But broadly speaking, COVID has reminded us of the high level of reliance New Zealand has placed on imported, often temporary and often underpaid labour. We have a chance to shift that balance, ultimately sending the message that New Zealand is not only open for business, but one of the best places in the world to carry it out is a critical message we wish to get out in the second half of this year. Finally, when the Director General of Health described COVID as a roller coaster that you haven't bought a ticket for, I think we could all relate. But we have reason to be optimistic. This year, we start a major transition, one that will eventually see fewer disruptions, but we hope achieve the same level of resilience. A degree of patience is still required, but we will get there. And to help with that, we will keep sharing our plans. We will keep talking about what we know when we know it. We'll keep being transparent about the challenges and the things that evidence and research is or isn't telling us yet. We have been open all the way through, and that won't change. In the meantime, my main message and request to everyone in the room is if you have questions around the vaccine program, our work around implementing the bubble, or anything else, pick up the phone. We are a small country. One of the benefits of that should be our accessibility, even to those who call during an event. Because after all, we don't just want to work together, we need to work together. So, let's get on with it. Nō reira, tēnā koutou, tēnā tātou katoa.